And as we've been hearing, one of the big concerns in all of this centres on the ability of hospitals to cope. 119 people with COVID were being treated in intensive care units last night. That's 31 more than just a week ago. Dr. Andrew Westbrook is an intensive care consultant at St Vincent's University Hospital in Dublin. He's also a council member of the Intensive Care Society of Ireland, and he joins us now on the line. Good morning.
Good morning, Rachel.
Talk to us first of all, if you would, about your own hospital. How are you doing at the moment?
Well, in our own hospital, we just to preface what I'm going to say, we had a video conference meeting on Monday evening. About 40 senior intensive care consultants, all members of the Intensive Care Society of Ireland, and we were also had a member from the Irish Critical Care Nurses Organisation as well. And the situation around the country in most of the intensive care units is grim. A lot of hospitals have had to curtail scheduled or elective surgery because they don't have the capacity and or the staff to look after complex elective surgical cases post-operatively in intensive cares. Ironically, actually, my own hospital is probably faring better than most, but the number of patients being admitted to the hospital at ward level is steadily increasing and has been increasing. And we know from the previous 3 waves that a certain percentage, maybe between 5 and 10% of patients who present to hospital with COVID-19 will ultimately require intensive care. And it's important to point out as well that in the first wave, we had no specific treatments for COVID-19. It was only in the second and third waves that we were beginning to learn more about the disease, that patients presenting to the acute hospital system with COVID-19 were being treated with steroids and other immunomodulatory agents. And that certainly helped in some cases. What we're seeing now is patients who come to the intensive care unit have failed that therapy. They've failed steroids, they've failed immunomodulatory agents. A lot of them are unvaccinated as well. So it's a much sicker cohort of patients.
Looking at the numbers of people needing intensive care at the moment, I suppose the one thing you could say is that at least it's not last January when there were more than 200 people in ICU. How concerned are you that we could return to those numbers?
Both myself and my colleagues are deeply concerned that we could return to those numbers. I think we need to remember that in the Republic of Ireland, we are ranked 25th out of 31 in terms of our bed capacity in intensive care. And that's pretty appalling. And this data was published in 2012. We've known about this since 2009. In fact, there was a report commissioned and published by a group called Prospectus, which advocated that we should, based on our population, have upwards of 450 or 500 intensive care beds. That was in 2009, 12 years ago. Here we are in 2021. Whilst in the last 12 to 18 months, we have increased our capacity somewhat from 255 to 301 beds. It's nowhere near where we should be, regardless, without sitting in the middle of a very serious pandemic. So the Irish intensive care capacity and staff numbers are very much behind where we should be, just to look after the normal day-to-day admissions that we get to the intensive care units across the country, medical, surgical and trauma patients. So to answer your question, am I concerned? I'm deeply concerned, because we are very rapidly facing a situation where we will exceed our capacity, not just in terms of beds, but also in terms of doctors and nurses who can provide the specialist care for these patients. And then you're into sort of surge capacity in other areas where the staff are not as well. They're just not as trained to look after these sick patients. So I'm deeply concerned.
Could the current situation have been avoided? I mean, given the rate of vaccination here, should we be seeing this many seriously ill people?
I think we're learning all the time about COVID, and data that came out from Israel over the summer, we should have, and I think it certainly gave us a clue that even after 2 doses of a vaccine, that there was evidence that there were more cases and clearly more people coming into hospital, and therefore there must have been waning immunity. And that was, if you like, reinforced by the fact that when the general population got a 3rd dose or a booster dose, that the case numbers started to fall again quite dramatically, and then subsequently the hospitalizations, and then ultimately those who came into the intensive care unit. I think the other thing to remember as well is that our society is open more now than it has been since essentially the beginning of March 2020. So we're almost back to normal in terms of socializing and meeting other people. Then you've got the winter where people are, they're forced indoors because of the weather and the fading light in the evening. So, and that combined with fading immunity from the very successful, I'd have to say, vaccination program, all of that coming together has culminated in a very dramatic rise in the number of cases, and the consequence of that is more people coming to hospital.
Is this what we can expect for the next couple of years at least, do you think?
My own sense, and talking to my colleagues in infectious diseases, is the bottom line is yes. And I think if we're going to want to function as a normal society where we can go out and meet people and interact with people, we're going to have to equip our healthcare delivery system with the capacity and the staff to withstand further waves in the future, and to carry out the normal functions of the healthcare delivery system, all of the normal neurosurgical, upper GI, cardiac surgical procedures, major complex vascular cancer procedures that go to the intensive care unit. If we want to be able to provide that level of healthcare, and I think we should, we're a first world Western democracy, we're a very wealthy country, we should be able to provide that care for our people. So we need urgent investment in capacity and critical care across the nation, and not just the beds and the machines and the infusion pumps. We need urgent investment in the people and to train them so that they can look after these very complex patients.
Dr. Andrew Westbrook, thank you for joining us this morning. That was Dr. Andrew Westbrook, who's an intensive care consultant at St. Vincent's University Hospital in Dublin.